Now, I'd like to spend some time discussing angiogenesis and the depiction of angiogenesis with ultrasound. As I mentioned, the tumors incite a vasculature off the host vasculature using what's called vasogenic endothelial growth factor. And this produces very abnormal vessels that, in fact, have areas of ischemia inside of the tumor. And you can see this area of ischemia can be very large and plays a very important role into what we see with color Doppler. Now, it became clear that with color Doppler, we were in fact not seeing the capillaries that are integral in the tumor angiogenesis process. In order for us to get a Doppler signal, a lot of these small capillaries would have to be flowing at the same time, 100 or more, to give a Doppler signal. So it was hoped that with the microbubbles we can in fact see the small vessels and come to a better appreciation of perfusion as defined as blood flow over time in a particular volume. Now, here's an animation showing what I'm talking about. We would grab a small capillary and we would image the microbubbles shown in blue through the blood flow inside of a tumor. So we were interested in this, in developing this technology, and basically we did many years of mice work with implanted tumors, and of course the microbubbles, as you can see here, are very small particles. They can pass through even the smallest of capillaries. And this is a picture of a microbubble. When increasing the mechanical index, the microbubble can be destroyed. This has a lot of potential in that if we destroy the microbubbles and then watch as they reperfuse, we can really come up with an idea of how the vascular bed how vascular these beds are. Now, this is a video showing a 1 centimeter implanted tumor, and by flashing we could see the microbubbles, as you can see here in white, in the capillaries inside of the tumor. Now, if we varied our flashing sequence, you can see in this tumor we could destroy the microbubbles and watch as they come in, or as in this case we do continuous visualization of the flow within the capillaries as the microbubbles perfuse this necrotic tumor. We can quantitate this activity in our time activity curve, where we can see the time to peak, the peak value, and the washout phase, and the area under the curve reflects the overall vascular volume. And this is shown in this image with the tumor and the time activity curve. We can also do a maximum intensity projection image and get an idea of what the vessel branching patterns are. And this has been termed the microvascular imaging. Now, tumors have approximately 5% of their total is made up of vessels, with, as you can see, 35% interstitium, about 60% of tumor cells. And this is a beautiful electron micrograph of the vascularity in normal tissues, with an orderly branching of arteries to arterioles to capillaries to venules, etc. Now look at the tumor. Tumor has a very abnormal vascularity, vessels that are big and small, and the transit time to get through something like this would be much greater. And that's what the microbubble technology is telling us. This is an intravital picture of tumor perfusion, showing some of the RBCs inside of the rat mesentery and the arteries next to the veins, as you can see there. But these are, this is the level that we're imaging with the microbubbles. So what we're doing is we're looking at tumor angiogenesis. In the angiogenesis of tumors, there's a destruction of the basement membrane by metalloproteinases, followed by a fibroblast extravasation through these gap junctions, and they set up small abnormal vessels. And as you can see, whether or not the microbubble passes in to the tissue or not is related significantly to the interstitial pressure. This has implications as to not only how we image them, but how the chemotherapeutic agents get into the tissue and fight the cancer. Now, there are many applications of microbubbles, including the therapeutic potential for targeting the microbubble to a certain receptor, to having drug encapsulated in a microbubble, improving gene transfection, for example. Now, getting back to contrast in the ovary, there have been several studies. The first study was from Finland, where they used Doppler, and Doppler has the problem of decreased temporal resolution and blooming, but they did find a difference in uptake time in tumors versus non-tumors, and this is a follow-up of their study showing that tumors had overall increased intensity and longer dwell time. This is a study from France which confirmed that. Now, our recently published study first looked at tumor morphology and then went into looking at the vascular areas inside of the lesion. After we determined where vascular regions were inside the tumor, DEFINITY was used in an IV setup, 1 microgram per kilogram, followed by a 10 cc solution of saline. The images were stored on an offline system using QLab, and the following parameters were quantitated: the wash-in time, the peak enhancement, the washout, and the area under the curve, which corresponds to the vascular volume. Now here we have an image of a cystic mass. This is the fundamental image, the 2 by 3 centimeter lesion. Here's the contrasted image. This is the microvascular or maximum intensity projection image. And as you can see, with the contrast flowing in, we saw no abnormal areas in the wall of the lesion, and we could determine that this was most likely a benign lesion. Now, here's the time activity curve when we look at this area of interest, and we can see that there's relatively sharp upstroke, but relatively little as far as peak intensity. And this is the 3D of this lesion showing the vessels and their distribution.